Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I am a certified dementia practitioner and the founder of Bambu Care. So if you didn't know already, in the spirit of my birthday month, we are doing a podcast every Wednesday for the month of May. So today's podcast is podcast number 2 out of 4 for the month of May. And today we are going to be talking all about UTIs and dementia and what the heck is the deal. But before we get into today's topic, we do have some quick housekeeping. So before I forget, next week's podcast episode is a Q&A. So if you want a chance for your question to be answered next week, be sure to submit your question to letsbamboo.link/QA, and of course the link is in the podcast notes. Number 2, you guys are so amazing. I could not ask for a better podcast audience. I really appreciate you guys consistently tuning into our podcast. I appreciate those of you who have left reviews. I appreciate the amount of support that you guys have shown for our new Dementia Care book, which is With Intent, a practical guide to navigating behaviors along the dementia care journey for those of you who are new here. And guys, your support has just been so unbelievable. Again, thank you all so much. If you didn't catch last week's podcast, we did extend our With Intent pre-orders to May 31st, so there is still a chance for you to claim your book or bundle at a discounted rate if you haven't already. And again, if you order before May 14th, then you will still be a part of the first batch that starts shipping out on May 16th. So if you're interested, please visit letsbamboo.com and click on the shop tab, okay? Also, don't forget that our May freebies are available on our website. This month, we've added the What is Dementia e-packet and a coupon clipping activity for your partner living with dementia. So if you're interested in our resources, either from this month or any of our previous resources, please visit letsbamboo.com and click on the resources tab. And you can actually add both our free resources along with your With Intent pre-order to your bag all at the same time, which is pretty cool and convenient. So let me think real quick if there's anything else that I need to mention. I don't think so. I think next week I might have an announcement, but not this week. Okay, so let's get into our talk about UTIs. So if you aren't familiar with UTIs, then there's a good chance that you will be at some point along your dementia care journey because they're a pretty big deal. So if you don't know, a UTI is a urinary tract infection. Now this sounds good, but if you don't know what a urinary tract is, then knowing that it's an infection of the urinary tract probably isn't helpful, right? So when you hear urinary tract, I want you to think urethra, bladder, ureters, and kidney, okay? So quick, simple anatomy lesson, okay? So the everyday person is going to have 2 kidneys, 2 ureters, 1 bladder, and 1 urethra, okay? Now, the kidneys have a lot of functions, but we're just going to stick to what's relevant to what we'll be talking about, okay? So the kidneys essentially are going to remove waste product from the blood and convert it into urine, which is going to pass from the kidneys to the bladder via the ureters, okay? Now, the bladder is going to then store the urine, and when it does this, it's going to expand to accommodate the urine. Now, the average healthy bladder will be able to store about 2 cups of urine for about 2 to 5 hours. And some of us push this, but 2 cups for about 2 to 5 hours. Now, to empty the bladder, okay, the bladder will contract and flatten, and the urine will pass through the urethra, which is a tube that leads from the bladder to the outside of the body. And then this is what then hopefully the urine, right, ends up in the toilet, but in some cases it might end up in odd places around the home or in something like a brief, okay? Now, normal healthy urine is going to be clear to light yellow, okay? Any darker than that, like if it starts looking like a honey or Coca-Cola type of color, then we can begin to expect issues with dehydration or infection, okay? So what can cause an infection in the urinary tract system, and why do infections seem so common in people living with dementia? I mean, some of you have realized probably with your partners that it seems like they just keep getting a UTI after UTI after UTI along their dementia journey, and it's like, what is going on? Okay, so this is a great question. So in general, UTIs are actually pretty common, especially in women. So about 1 in 5 women will actually experience a UTI at some point in their lifetime. The way that our anatomy is set up pretty much sets us up for failure. And this remains true even with a diagnosis of dementia. Okay, so in women, the urethra, remember the tube that leads from the bladder to the outside of the body, is much shorter than a man's urethra. And it's conveniently near the anus as well, which of course can harbor bacteria, especially E. coli bacteria, which is responsible for the majority of UTIs, okay? Now, in men, when we think about their anatomy, the urethra travels through the penis and is longer, and well, for most men, it's not very close to the anus, right? So one of the main ways that a person gets a UTI is when bacteria that typically lives near the genital and anal areas enters the urethra and can infect any part of the urinary tract. So it can infect the urethra, the bladder, the ureters, the kidneys, and essentially in this situation, the longer the infection goes untreated, the more that it can spread, and it can become life-threatening as it can cause septicemia and sepsis, which essentially means that the infection has spread to the bloodstream, which we do not want, okay? Now, just by me saying this, many of you may already be able to tell what can go wrong here when it comes to persons living with dementia. But there are also some less obvious reasons why people living with dementia are prone to UTIs as well. But let's just start with the more obvious reasons, okay? So a big reason is decreased thorough hygiene practices. So as dementia progresses, a person will begin to have more difficulty with managing their personal hygiene and cleaning themselves properly and thoroughly. Women may also forget the proper direction to wipe, and not only forget the proper direction to wipe, but realize that you can't wipe front to back, right, and then re-wipe. You need to throw that away and start with a fresh tissue or wipe and wipe again, right? Because if you're just using the same one, even if you are wiping front to back, you're still putting yourself at risk for pushing bacteria from the anus or feces, which is primarily bacteria, into the vagina, okay? A person living with dementia may also refuse assistance from others in this domain as well, because managing these sorts of things are private and sensitive matters, and everybody just doesn't go for it openly and willingly, okay? Another biggie are those infamous briefs, okay, which can be a breeding ground for bacteria. And this is why changing incontinence briefs and incontinence pads several times a day is super important. But this can be difficult if your partner refuses to change their own, insisting that it's fine and they don't need to change it, or they won't let you help them change it. So again, this increases the risk of a UTI as well, okay? Now on to less obvious reasons. So the largest risk factor for dementia, especially if we're talking about Alzheimer's disease, is age, right? So as a person ages, things start changing and maybe don't work as well as it once did. So one issue that we run into is urine retention, which is the inability to fully empty the bladder. And this is actually more common in men. Now, there are actually a few things that can cause urine retention, one being weakened muscles in the bladder or the pelvic floor, another being blockage by something, so it could be like an enlarged prostate or kidney stones or a sagging bladder or rectum, so essentially a prolapse, which can then press on the urethra, which is again that tube that leads from the bladder to the outside of the body. Okay, constipation is another thing that can cause an issue, some medications, or there can be a nerve or a neurological problem, such as dementia, but there are some other issues, which can then affect signals from the brain to the bladder. Now, the issue with urine retention is that you end up exposing your body to harmful bacteria that was meant to be released, and therefore can cause infection, okay? Urine retention can also create backflow within the urinary system, which can lead to a kidney infection as well. So yeah, urinary retention can be a very big issue. And also, as people age and also with dementia, the immune system doesn't work as effectively and efficiently as it once did. So it's harder for the body to naturally fight some of these infections away. So they're more susceptible to getting an infection. Okay, then we have dehydration. Okay, now dehydration is also known to increase the risk of UTIs. And as we talked about in a previous podcast about dehydration and dementia, it's a pretty big problem. But the big question is, of course, why can dehydration increase the risk of UTIs? Well, for one, if you aren't drinking enough fluids, then you may not pee as often as you should, as often as necessary, which then allows the urine to sit in the bladder for longer than it should, okay? Also, if you aren't drinking enough water, then it can concentrate the urine that's in the bladder, making it more potent, which can actually end up irritating the lining of your bladder and cause inflammation, which then triggers other issues. Concentrated urine can also create kidney stones, which I previously mentioned, can create blockages, which can then lead to urinary retention, which we've already discussed is a big issue. So as you can see, there are actually many reasons why UTIs are so prevalent in those living with dementia. And it is my hope that I've explained this pretty well and that it finally makes sense, because I know it's one of the top asked questions, okay? Now, some of the hallmark signs of a UTI include the frequent urge to pee, burning pee, and pelvic or low back pain. And if you've ever had a UTI, these may be the first things that you've personally noticed. However, in people living with dementia, they might not be able to communicate these symptoms, and so you'll notice other symptoms begin to show itself, like increased agitation or aggression, change in appetite or sleep patterns, fatigue, increased confusion, or just an unexplainable decline in function. Maybe they're having difficulty walking, they can't get out of bed now, they're having increased falls, things like that. Now, if you're involved in the toileting process, then you may also notice increased incontinence, dark and or cloudy urine that has particles in it, and a strong odor, okay? And if you notice any of these symptoms, it's so important that you seek immediate medical attention so that your partner can be properly diagnosed and prescribed antibiotics if appropriate. If it is an infection, right, you don't want the infection to spread. As I mentioned before, the longer that an infection festers in your body, the more it can spread. And the one thing we don't want it to do is get into the bloodstream, because that's where septicemia comes into play, that's where sepsis can come into play, that's where the potential for death comes into play, and we don't want that, right? So it's so important that you try to catch it as early as possible. Now, some people want to know, well, why are there such drastic behavior changes when it comes to a UTI. You know, for most of us, if we get a UTI, we notice those things that I mentioned, like the frequent urge to pee, the burning pee sensation, pelvic or low back pain, but we don't have any of those behavioral symptoms. Now, the reason for this is pretty inconclusive, as people can't seem to agree on what the reason for this is. But what I will say is that any type of infection is very stressful on the body. And a person living with dementia, their body is already working as hard as it can. Their brain is already working hard to help them function. So anytime an infection is introduced into the equation, there can be a breakdown, okay? Also with the brain changes, there's going to be a change in their immune response as well. And so what you see may look a little bit different than you would see with someone who's not experiencing those brain changes. So basically you get a different outward expression of symptoms. They still may be experiencing the urgency to pee, the burning sensations, the pain, but they just can't communicate that. And so you see these other things as well. And then another reason might be that the infection might be in their system a lot longer than it may be for us, because we're more acutely aware of those symptoms and we can get it taken care of a lot quicker. Whereas for them, it's not until those behavioral symptoms start showing that we are even suspicious that there might be an infection going on. And so it could be also because that infection is festering in their body a lot longer, which then allows for those additional symptoms to show itself. So like I said, the real reason for this is pretty inconclusive, but just know that infections wreak havoc on the body, and the body works so hard to fight off infections, okay? So after learning what we've learned about what can cause a UTI and the symptoms and presentation, the next big question is, well, how can I prevent it? How can we prevent it? And this is the fun part because it's so much easier said than done, okay? But here's 3 quick tips, okay? So number 1 is water, 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 okay? So we're already off to a good start, right? I know just how hard it can be to get your loved one to drink water. But don't forget that high water content foods are also an option to help increase water intake. And I'll also link a podcast where we discuss tips to get your partner to drink more water in more depth in the podcast notes, okay? Number 2, you want to encourage thorough personal hygiene practices. So you can do this by encouraging the use of wipes. You can cue your partner, especially if they're a female, to wipe front to back, to dispose of the tissue between each wipe. Encourage frequent brief changes. You may even need to try to put your partner on a toileting schedule. And of course, you want to encourage your partner to take regular showers. Yes, the dreaded shower. I've actually done a podcast episode on 10 reasons why your partner won't shower. And so I'll link that too, but I still need to do a follow-up episode on tips and tricks to get your partner to shower. So that'll be coming soon sometime, okay? Then tip number 3 is that you want to avoid or limit bladder irritants, okay? So these are things like alcohol, caffeine, citrus juices, and spicy foods. Now, in my opinion, this one's pretty sucky, if I do say so myself, but if your partner is prone to UTIs, then you want to prevent the urinary tract system from becoming irritated and inflamed, because that can then cause other issues. Now, a lot of people want to know about the cranberry juices and pills and the probiotics, and honestly, the evidence of effectiveness is pretty inconclusive with this as well, but it typically doesn't hurt to give it a try, okay? So just run it by the doctor and see what they recommend and if it's an appropriate option for your partner. So hopefully you all found this podcast helpful and informative without it being too long. Remember, if you do have a question that you would like answered on next week's Q&A podcast, you can submit your question at letsbamboo.link/QA. Again, the link is in the podcast notes. And also, don't forget to pre-order your With Intent book at letsbamboo.com. So thank you guys so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.